Maximal oxygen uptake, or VO2 max, is a measure of how much oxygen your body can use during intense exercise. It is a key indicator of cardiovascular fitness and endurance. A decline in VO2 max as a result of aging has been attributed to the age-related decrease in muscle mass, sarcopenia. A decrease in muscle mass has long been known to play a significant role in VO2 max as the shift from metabolically active muscle tissue moves to inactive adipose tissue. So far, we've discussed positive effects of blood flow restriction training in strength and hypertrophy when combined with low-load exercises. You might be wondering, does BFR have the same positive effect on endurance when combined with low-intensity exercises? Exercises such as cycling and walking are traditionally viewed as not enough to induce hypertrophy and strength, but have been shown to improve maximal oxygen uptake, VO2 max. Some studies even show that aerobic exercises can interfere in strength training. Moreover, only a few studies in the past have found improved hypertrophy and aerobic capacity from a single modality, but they involve long duration or very intense training sessions. A study published in 2010 examined BFR cycling at 40% VO2 max for 15 minutes compared to a control group that cycled for 45 minutes at 40% VO2 max without BFR, carried out 3 days a week for 8 weeks. At the conclusion of the training, the authors found increase in thigh and quadriceps muscle volume, increased maximal isometric knee extension strength, and increased VO2 max. An increase in exercise time to exhaustion in the BFR training group, but not in the control group. Note that any increase in strength from a training program without concomitant increase in muscle size can be attributed to neuromuscular adaptations. The minimum intensity taught to produce change in VO2 max is 50%, and the magnitude of change in VO2 max increases as the exercise intensity increases from 50% to 100% VO2 max. The lower the stimulus, the longer the duration of exercise needed. The 2010 study used very short duration, 15 minutes, and very low intensity, 40% of VO2 max, but still demonstrated changes in VO2 max, muscle size, strength, and time to exhaustion. The authors explained that the change in VO2 max to be related to a decrease in stroke volume, secondary to the tourniquets, and an increase in heart rate to maintain cardiac output. From the maximum heart rate, the authors were able to average the intensity of the BFR group to be 59% VO2 max, which is within the effective training window for aerobic adaptations. The authors also speculated that the increase in VO2 max after BFR cycling might be related to the increased hypertrophy seen in the BFR group. With increased muscle volume comes increased mitochondria. Please refer to the video about how satellite cell proliferation and the incorporation of new myocytes with the help of IGF-1. Another study published in 2014 looking at the effect of BFR cycling on endurance using a severe intensity cycling protocol with subjects divided into BFR group and non-BFR group, with both groups cycling at 30% of peak. The authors found improved time to exhaustion with the BFR group but not with the control group, and concluded that the physiologic strain induced by BFR, not the intensity, is responsible for the changes observed. This further confirms the assumption that BFR requires greater energy demand compared to work-matched controls. A study that looked at walking with and without BFR among elderly adults for 10 weeks, walking for 20 minutes, 4 days a week at a low intensity, 45% heart rate reserve, found increased maximum knee joint strength and thigh cross-sectional area only with the BFR group. Another study with older adults, walking 5 days a week for 20 minutes at a normal walking pace over 6 weeks with and without BFR, demonstrated improvements in knee strength and muscle cross-sectional area of the thigh and lower leg only in the BFR group. Additionally, functional improvements were seen on the timed up and go and chair sit to stand tests for the BFR group. The same authors demonstrated a significant increase in knee strength, thigh cross-sectional area, and growth hormone response that peaked out at 13 nanograms per milliliters after walking with BFR, and with no such changes in the control group. Increased plasma growth hormone as high as 40 nanograms per milliliter after exercise with BFR has been reported previously. In studies that have measured metabolite accumulation after BFR exercise, there are conclusive evidence to suggest substantial increase in strength and hypertrophy of proximal muscles, with hypertrophy appearing to be the downstream effect of a sufficient metabolite buildup. Here we have learned that BFR can be used to improve endurance, even with low-intensity exercises such as cycling or walking. If you like this video and would like to learn more, please hit the like and subscribe buttons. And as always, thank you for watching.